Because wearing off is experienced as a result of a return of symptoms of Parkinson's disease, it is important to be aware of what symptoms occur. These symptoms can be motor symptoms related to movement or non-motor symptoms not related to movement. I will now go through the motor symptoms that are related to movement that occur in wearing off. People with PD often have a resting tremor or shaking affecting one or more limbs. It is one of the most common features of Parkinson's disease. Typically, the shaking occurs at a rate of around 4 to 5 times a second. Gets worse when somebody with PD is stressed, worried, or anxious, or even excited, but goes away during sleep. Difficulties with speech may occur. This may take the form of a lower volume, softness of voice, hoarseness, reduced articulation, or tremor or speaking in a monotone. Problems with balance usually affect people who have had Parkinson's disease for a long time. People with PD who have poor balance are at an increased risk of falls. People with Parkinson's disease can feel stiffness. It can be felt in the wrists, usually one side more than the other, but stiffness can occur all over the body. This is known as cogwheel or lead pipe rigidity. People with Parkinson's can also have trouble starting movements or continuing movements. The automatic centre for movement in the brain sometimes switches off. Some people have reduced dexterity in one or both hands. This can make it difficult to complete tasks where fine motor control is needed, such as buttoning a shirt, using a knife and fork, or tying shoelaces. When the increased muscle tone and rigidity is severe, muscle cramping can develop. Cramping commonly affects the legs, calves, shoulders, or arms, and often occurs at night. Getting up from a chair or from a low level, such as getting out of a bed or a low couch, can be troublesome for people with PD. They have to think about the movement more and break it down into stages. People with PD can feel weak and tired and often fatigue easily. This can be related to a poor night's sleep, excessive daytime sleepiness, or the rigidity and slowness of movement. Although the movement symptoms related to wearing off in Parkinson's are the most obvious, the non-movement related symptoms can be the most troublesome. I will now go through the non-motor symptoms that occur in wearing off. Some people experience panic attacks where they feel intense fear or worry, which can manifest itself physically in such ways as a racing heart, dizziness, or shortness of breath. Panic attacks most often occur during the wearing off phase. People with PD can have an increase in sweating. This is due to a disturbance in the autonomic nervous system. Skin oils can also be commonly secreted. This can become very uncomfortable for the person, and they may even have to change their clothes several times a day. Mood changes are common in Parkinson's disease, particularly the development of low mood, although major depression is rare. However, people with PD may look depressed due to a reduced degree of facial expression. But once depression is recognised and treated, the person with PD recovers well. People with PD can also experience changes in sensation, such as numbness, tingling, or pins and needles. This is often of their fingers and toes. Anxiety symptoms, such as the feeling of worry, are common in Parkinson's and can often show up before movement-related symptoms occur. Anxiety can contribute to poor sleep for people with Parkinson's. Sometimes a vicious circle emerges, where anxiety leads to a worsening of movement symptoms, and the worsening of movement symptoms can make people feel more anxious. Some people with Parkinson's disease complain of poor attention, a slowness of thinking, and finding it difficult to concentrate. They often describe it as a cloudy mind, or that their thinking is dull. Some people with PD feel that their hands and legs are freezing, although a change in temperature may not be detected by their doctor. Others complain of feelings of warmth, which can be accompanied by flushing of the skin. Discomfort in and around the abdomen has also been reported by people with Parkinson's who have developed a wearing off. They can describe it as a butterfly-type sensation or even a burning sensation. Pain can affect up to half of the people with PD. People with Parkinson's disease can experience aching all over the body. Sometimes the aching moves from site to site. Some people also report the inner feeling of restlessness. Wearing off symptoms may be difficult to identify, and they may be very subtle at first. Your PD nurse specialist and doctor will determine if you have wearing off by the symptoms that you tell them. There are a variety of approaches used in the management of the symptoms of wearing off. Everyone is an individual and should be assessed accordingly. The main approach is to enhance the effect of levodopa, making it last longer. So remember, you are not alone. If you have PD or know somebody who does, there's a lot of information and support available. You can log on to the www.wearingoff.com website for further information. You can also contact your local support group, the Parkinson's UK or the Parkinson's Association of Ireland. Thank you for taking the time and watching this presentation, and I hope you've learned a lot from it.